Welcome to Boston Community Health. I'm Dr. Elias Thorne. Many individuals feel deeply confused when witnessing their blood glucose spike in the morning despite fasting all night today. I will demonstrate a simple 3-step protocol designed to activate your body's natural elimination pathways right during your sleep. Most older adults mistakenly assume that elevated morning blood sugar merely represents a device tracking error, completely unaware that counter-regulatory hormones are silently ravaging their delicate vascular walls throughout the night. Clinicians define this specific early morning glucose surge as the dawn phenomenon. As your body naturally prepares to awaken around 4 to 5 a.m., a hypothalamus signals for adrenal glands to release massive volumes of counter-regulatory hormones like cortisol and epinephrine. These hormones function exactly like a barrier-blocking active insulin utilization, while stimulating the liver to continuously dump stored glycogen into your bloodstream for energy. Inside a perfectly healthy circulatory system, the pancreas automatically secretes additional insulin to maintain smooth, balanced, and fluid blood flow velocities. However, inside individuals past age 40 already possessing cellular insulin resistance, the damaged pancreas fails to compensate and secrete sufficient insulin volumes. Consequently, excess glucose molecules become permanently trapped within the vascular lumen for several critical hours before you awaken. Your bloodstream transitions from a vital nutrient fluid into a thick, toxic solution saturated with inflammatory agents. This persistent nocturnal hyperglycemia silently erodes and microscopically scratches the smooth, non-stick endothelial line protecting your major carotid arterial architecture throughout the night. To identify your root cause, our first method incorporates implementing a blood glucose tracking protocol at 2 a.m. Please click like, subscribe to Boston Community Health, and comment right now. Their 2 a.m. metric represents vital clinical evidence helping physicians differentiate the dawn phenomenon from the Somogyi effect. If your midnight blood sugar appears perfectly normal but spikes sharply upon awakening, your vasculature is handling counter-regulatory hormone loads, demanding a tightly structured lifestyle modification strategy. Paradoxically to the dawn phenomenon, the dangerous Somogyi effect unfolds when your blood glucose drops excessively low during midnight hours due to compounding medication overdoses or misplaced insulin injections. The moment blood sugar plunges to survival thresholds at 2 a.m., your brain panics, triggering an emergency hepatic response to forcefully dump all stored glucose to save starving neurons. This emergency hepatic sugar dump forces your systemic blood pressure and morning glucose to spike toward dangerous record metrics. This abrupt mechanical pressure surge exerts immense stress on fragile atherosclerotic plaques within the carotid artery, expanding the risk of plaque rupture traveling upward to block cerebral oxygen. This explains why the vast majority of severe embolic strokes strike during early morning hours. If you fail to track your midnight metrics, you might misassume insulin deficiency and dangerously elevate medications, entering a deadly loop. Actionable management step number 2 to resolve this problem tonight focuses on establishing a super low carbohydrate dinner pattern. The vast majority of adults consistently maintain the habit of consuming a heavy, starch-rich dinner following an exhausting workday. When you overload your system with large portions of white rice, pasta, or processed bread in the evening, these carbohydrates convert into cascading glucose volumes. Your vascular network is forced to begin the night handling a massive sugar load, leaving your pancreas completely helpless. Implement the strategic option of shifting your favorite carbohydrate portions entirely toward your lunch hour. Lunchtime represents an active period where you consistently move, walk, or work, allowing your body to easily utilize and burn that sugar for physical energy. For your dinner menu, firmly construct your plate using fiber-dense green vegetables combined with clean proteins from fish, poultry, or eggs. This simple behavioral shift maintains your pre-bedtime glucose at perfect baselines, completely lifting the chemical pressure straining your vasculature. Actionable management step number 3 incorporates utilizing a structured, moderate daytime physical movement protocol. Many older adults frequently present arthritis or back pain as excuses to abandon exercise, selecting a sedentary lifestyle on the sofa throughout the evening. This represents the fastest air destroying your vasculature. Initiate a brisk 15-minute stationary walk immediately following your lunch. This mechanical contraction compresses major muscle groups, stimulating cell membranes to actively open and draw glucose directly from your bloodstream. The biological efficacy of this targeted physical training does not terminate the moment you stop moving. It possesses the clinical capability to last continuously for up to 24 hours. This means if you exercise consistently at 7 a.m. today, your skeletal muscle fibers maintain an underlying active state, absorption of excess glucose throughout the night, helping your next morning's blood sugar drop spectacularly without elevating hazardous chemical prescriptions. If you suffer from mobility restrictions driven by severe bone or joint injuries, implement the alternative solution of continuous stationary calf raises while seated. This routine activates the soleus muscle within your lower calf, a unique muscle mass possessing an incredibly high capacity to metabolize glucose and lipids without inducing physical exhaustion or knee strain. Complete this toe-pressing movement, elevating your heels fully 15 to 20 times per set, executing 3 sets daily to shield your vessel walls. Actionable management step number 4 to flush blood sugar overnight focuses on optimizing your systemic hydration strategy. Your kidneys represent the primary organ filtering blood and excreting excess glucose via urine output. When your body enters a chronic dehydrated state, your bloodstream thickens, fluid osmolarity climbs, forcing the kidneys to conserve water while blocking the natural elimination of excess glucose molecules. This explains why individuals consuming low water volumes during daytime hours showcase elevated morning fasting glucose. However, a dangerous clinical trap you must avoid is concentrating your entire water intake into the late evening hours before bed. Consuming excessive water volumes after 8 p.m. aggressively activates your bladder, forcing you to awaken for urination 3 to 4 times nightly. This continuous sleep fragmentation represents a severe neurological stressor, skyrocketing your morning cortisol levels at dawn, indirectly triggering intense early morning blood sugar spikes and acute cerebral vascular spasms. The WISE hydration protocol requires consuming your full 2 liters of water distributed evenly from morning until 4 p.m., subsequently tapering fluid volumes in the evening to safeguard deep sleep architecture. When your system is well hydrated during daytime hours, the kidneys operate smoothly, gradually filtering and excreting excess glucose molecules through urine all night without disrupting your sleep. Actionable management step number 5 to protect your endothelium from chronic glucose involves utilizing clinically proven natural medical supplements. A vast majority of type 2 diabetic patients suffer from severe deficiencies in powerful antioxidants due to chronic systemic inflammation. Incorporating natural compounds like herbal extracted berberine or alpha-lipoic acid functions effectively as a medical assistant to improve cellular insulin receptor sensitivity, assisting in clearing trapped glucose molecules out of your vascular network safely. Currently, inside the United States medical market, specialized prescription medications like Jardiance or Forxiger operating as SGLT2 inhibitors are highly prevalent. The pharmacological mechanism of these agents forces the kidneys to open filtration pathways to aggressively flush excess glucose through urine whenever levels exceed 100. I do not promote nor dismiss these chemical agents. Occasionally, they represent a necessary evil when their natural home protocols completely fail to preserve failing organ systems. However, the primary clinical pitfall of relying solely on these forced elimination agents is the severe side effect of heavy nocturnal urination. If you consume these medications in the evening without managing your carbohydrate intake, the drug continuously forces a renal operation all night, driving you to the bathroom 3 to 4 times. Once again, your deep sleep architecture is fragmented. Stress, cortisol spikes at dawn, neutralizing the drug's efficacy and pushing your next morning glucose upward. Therefore, I consistently designate these forced chemical agents as a last resort, a critical backup solution when the body has already entered severe pancreatic beta cell exhaustion. A specific segment of patients maintains a passive mindset, telling me just give me the strongest prescription. I refuse to modify my pizza diet or change my sedentary couch habits. This represents vascular suicide. Medications merely manage symptoms. If you fail to sever the route of insulin resistance, your vasculature will collapse. Conversely, for the vast majority of individuals who attempt their best but face rigid genetic factors or social difficulties keeping glucose elevated, combining targeted natural supplements alongside a minimized prescription dose under strict medical supervision represents the wisest roadmap. You are never isolated on this journey. Incorporating these 5 natural home methods systematically minimizes drug burdens over your liver and kidneys, perfectly preserving your physical independence and vital life energy past 60. Another critical clinical error during middle age involves completely omitting your blood glucose tracking immediately upon awakening or delaying your measurement for several hours without eating breakfast. Many individuals wake up exhausted but choose to fast while commuting to their offices, finally performing a test before lunch. The measure captured at this point appears highly elevated, leaving you confused regarding where the sugar originated while your stomach is empty. In reality, your liver continuously launched defensive glucose spikes. When you fast excessively after awakening, your brain assumes a state of starvation, triggering hepatic gluconeogenesis to secrete extra sugar. Please click like, subscribe to Boston Community Health, and comment your morning metrics below. This endogenous sugar wave continuously erodes your endothelial lining, accelerating plaque buildup inside carotid pathways. Therefore, the management solution is executing your glucose test within 15 minutes of stepping out of bed to capture the most accurate clinical data. Comprehending this entire synchronized biological framework regulating nocturnal glucose metabolism grants you the precise medical roadmap to construct a comprehensive metabolic shield protecting your central nervous system. You no longer need to analyze elevated morning blood sugar numbers with a sense of passive helplessness. Accurate clinical knowledge and today's 5 actionable home options represent the weapons helping you dominate your health destiny, preserving the non-stick integrity of your vasculature. Alongside implementing our 5 natural home interventions, the wisest roadmap to completely halt the destructive impact of chronic hyperglycemia is coordinating your routine with advanced diagnostic screenings inside specialized clinical facilities. The primary essential neuroimaging process involves undergoing an annual duplex carotid ultrasound evaluation behind the neck to visually analyze plaque architecture and accurately measure the exact percentage of arterial narrowing. Your carotid arteries represent the singular highway delivering oxygen-rich blood volume from your heart to your entire brain architecture. When chronic nocturnal hypoglycemia continuously erodes the endothelial lining, it constructs highly unstable, fragile, and loose atherosclerotic plaques. Under the constant mechanical shear stress of daily blood flow, the thin fibrous cap covering this buildup can easily rupture, causing cholesterol debris to detach and launch directly into cerebral circulation, blocking small deep arteries, producing permanent lacunar infarcts, destroying your neurons. The primary clinical tragedy is that these deep microvascular injuries unfold completely silently, without ever triggering immediate physical paralysis or facial drooping, causing patients to neglect them. However, across chronological decades, dozens of these tiny white lesions accumulating on your cerebral cortex will severely destroy white matter architecture, fracturing vital neural signaling transmission, heavily accelerating the progression of chronic vascular dementia or irreversible memory decline, ruthlessly stripping away your personal independence past the age 60 milestone. The supreme diagnostic option to permanently expose these hidden injuries involves undergoing advanced structural brain evaluation via high-resolution MRI scans inside authorized hospitals. Standard clinical checkups remain completely blind to these localized threats expanding inside your skull framework. An MRI film functions effectively as a visual mirror helping neurologists accurately locate existing lacunar infarcts, subsequently implementing targeted antiplatelet and vascular therapies early, successfully shielding your nervous system before catastrophic major vascular event strikes. To successfully transform today's complex scientific knowledge into a practical protective weapon for your next checkup, I want to provide a concise clinical communication protocol consisting of 3 strategic questions to discuss directly with your healthcare provider. You do not need to live under passive anxiety or surrender your health destiny to an unfeeling automated medical framework. When you confidently present these highly informed academic queries, you force the physician to concentrate on constructing a personalized prevention framework. Strategic question number 1 you strictly need to present to your physician is, based on my middle-aged physical status and current insulin resistance, what are the exact target blood pressure metrics and optimal hemoglobin A1C thresholds I must maintain during home logging? This crucial query forces the clinical conversation toward establishing a clear biological milestone, completely eliminating vague guesswork, allowing you to accurately evaluate the real-world efficiency of your daily microvascular movements. Strategic question number 2 you strictly must discuss during your clinic appointment is, given my structural vascular risks from chronic hypoglycemia complications, am I an appropriate candidate to undergo a duplex carotid ultrasound and a brain MRI scan to evaluate for silent lacunar infarcts? This question advances your medical dialogue into specialized neuroimaging dimensions, completely exposing and detailing underlying arterial threats inside your skull before devastating physical complications erupt. Strategic question number 3 you strictly need to ask to finalize your protective shield is, do I require an overnight 24-hour Holter monitor evaluation right at home to completely rule out paroxysmal atrial fibrillation risks? Presenting this complete trio of strategic queries demonstrates that you represent a highly informed individual possessing profound wisdom during your personal journey to safeguard your physical freedom and cognitive clarity across lifespan. Any ethical, highly competent physician will completely welcome these 3 strategic questions from you. They will deeply respect your medical intelligence and appreciate your self-advocacy, because they comprehend that an informed patient represents an exceptional partner during a long-term therapeutic journey. Conversely, if your physician dismisses these questions or makes you feel difficult, that acts as crucial diagnostic information proving that specific doctor is simply not the right fit for your longevity path. The ultimate goal of geriatric medicine at this stage must be protecting your actual quality of life, preserving your personal independent living, your physical energy, and maintaining your capability to do what truly matters. You possess every single right to know exactly what a screening test is looking for inside your body, avoiding an unfeeling automated checklist dictated by an impersonal medical framework. Cole and I want to leave you with a profound clinical philosophy of geriatric medicine, the devastating complication you successfully prevent through your intelligence and consistent daily movement will never make dramatic breaking news. The stroke or heart failure pushed back from afar carries no intense resuscitation moments inside an emergency operating room. It remains completely quiet. The beautiful outcome of that wise prevention is just an ordinary morning where your brain stays sharp, your steps remain steady, and you continue enjoying warm conversations with family. Now, let us bring all of today's vital medical insights together into a powerful protective action. We have thoroughly exposed the true nature of this master disease through sugar-induced vascular damage, launching a catastrophic organ domino effect encompassing ischemic strokes, dementia, congestive heart failure, renal failure, blindness, and foot necrosis. This represents a highly concerning clinical landscape, yet it remains fully within your personal control if you initiate behavioral modifications immediately starting tonight. Our 5 natural home interventions incorporate establishing endothelial protective nutrition, brisk walking for 15 minutes post-lunch, utilizing the sequenced 5-first dining protocol, optimizing sleep architecture against cortisol, by distributing water during the day and incorporating targeted natural medical supplements. This represents your ultimate comprehensive framework to protect your entire vascular system naturally and wisely, successfully maintaining your peak physical vitality regardless of the passage of chronological time across your lifespan. Alongside clean lifestyles, memorize 3 strategic questions during your next physical checkup, asking about your target hemoglobin A1C, requesting a duplex carotid ultrasound, and discussing a continuous Holter monitor evaluation. Write down these 5 methods and 3 strategic questions on a physical sheet or store them inside your phone app to serve as your permanent roadmap for safe movement and nutrition. Share this educational video link with the people you care about most, a spouse living alongside you, an aging parent, or a sibling over middle age who needs this vital screening data. The individuals who are at the highest statistical risk of facing the sugar-induced vascular storm will likely never search for these clinical studies online. Your small act of digital sharing today might become the exact reason someone's vascular system is saved from a devastating future neurological event. Your self-advocacy allows them to preserve their cognitive mind to live an independent, happy life of healthy longevity. I am Dr. Elias Thorne from the trusted medical organization Boston Community Health. Our professional mission is to deliver honest, international geriatric knowledge without fear-mongering to help you dominate your health destiny. Your brain and cardiovascular system remain completely priceless assets, deserving your highest level of wise protection daily through simple daily habits. Always stay sharp, stay highly informed, and master your own destiny. Within next week's educational series We will deliver advanced clinical investigations targeting strategies to shield your cognitive memory architecture, preventing chronic neurodegenerative syndromes in older adults. This represents a highly critical subject helping deconstruct your complete neurological defense network, maintaining your peak intellectual clarity regardless of the passage of chronological time. Do not delay another single day. Select just one single action item from today's checklist to implement immediately within your life. The compounding effect of a small habit extending from day to day creates a highly powerful anti-aging clinical intervention over time, successfully preserving the non-stick integrity of your cerebral and coronary blood vessels. A sharp cognitive mind and physical independence represent your most priceless assets to thoroughly enjoy your peace and complete happiness alongside family. Modern medicine is not just about saving lives on operating tables, but more importantly, ensuring you never end up there by identifying LACN or infarct risks early during dorm hours. Coordinating your blood sugar test within 15 minutes of waking up grants you the most authentic clinical data, helping you implement proactive modifications dynamically, effectively shattering the destructive cascading loop driven by chronic type 2 diabetes. We will consistently remain here to deliver the most authentic, scientific, and evidence-based knowledge throughout your health autonomy journey. Our professional team is committed to standing alongside you to uncover hidden medical pitfalls, providing practical options, helping you shield your household from afar, navigating safely toward a healthy longevity filled with maximum physical independence and vital life energy. Initiate your moderate microvascular exercise routines or implement your sequence dining protocols starting today to successfully preserve the non-stick integrity of your cerebral vasculature throughout the night. Please click like and subscribe to Boston Community Health right now and leave a comment below about the actionable step you select to flush glucose overnight. Wishing you continuous health and see you next time.